Okay, so back pain, tight hip flexors, couch stretch. So again, it's very common those with back issues to have tight hips, tight hip flexors, tight glutes, other bits and pieces around your hips. So obviously if something's tight, our first instinct is to want to stretch it and loosen it to give ourselves some relief. But again, we need to understand that the body's very clever at reacting and creating symptoms of problems as a kind of reaction to other underlying problems you're not necessarily aware of. So tight hip flexors is a symptom of other stuff going on, particularly around the back and the hips, not necessarily the problem itself. So short term, if you're lucky, you can stretch your hip flexors out with a couch stretch, which looks like this. And yes, you will get some temporary reprieve. It will feel like it's lengthened your hip flexors and taken some tension off. It might give you some movement on your back. However, there's a couple of problems with that. One, your hip flexors, if they are tight generally because there's a lack of stability. Usually you'll find one is tighter than the other, which again for me is a big clue you've got an issue with lateral stability. So what's happening is your body's missing components here to generate that side-to-side stability. It's clamping down on one set of hip flexors or record more than one side, which I think for me is a big red flag that someone's lower back is literally about to implode. So again, I wouldn't really stretch stuff out because again, that's almost like your body's, it's trying to find a solution to a problem and then you're just trying to remove its solution without actually addressing the underlying problem or give it an alternative. So short term, it might give you a little bit of relief, but long term, it's not really going to solve your problems. What we need to look at is lateral stability and also probably glute control as well. Because if you've got good lateral stability and the glutes are working well, that tends to stop those hip flexors from wanting to be tight, because the thing is they're basically being overworked. So if they're being overworked, they're making up for other things not doing their job. So again, rather than trying to kind of like stretch them into submission and make them give up, we want to work on the issues that, the things that aren't doing their job, get those to kick in. They've got less work to do, therefore they'll be less tight. The other thing we need to be careful of if someone is extension intolerant. So I test that with a few variations of disc recovery position on the floor. So we start with sort of 2 palms under the head, 1 fist, 2 fists, just to give them that little bit of extension test to see what their tolerance is like. So this can happen in cases where people have had end plate fractures or disc herniations and they've lost a significant amount of disc height. What actually happens is your facet joints at the back of your vertebrae will actually start to kind of basically clash together, is what I'm going to say, because you haven't got enough room for them to actually slip into extension without them kind of making too much contact with each other. Particularly if you've got 1 or 2 bad discs, it's going to focus that extra extension strain around the facet joints in those locations. So even doing something like a couch stretch for someone with tight hip flexors, you're basically going to force them into probably a bit too much extension. And what will happen is, you're not going to aggravate the disc issue, because that's not mechanically how a disc issue works, but it's entirely possible to then aggravate and give someone more of an issue with aggravation in terms of facet joint irritation and inflammation. So although you've got the best intentions to try and relieve tight hip flexors, the way you're doing it might inadvertently cause another problem. So again, that's why when we do things, we need to test first of all, not guess. We need to see the mechanics of the person's injury, and we need to know what the rules of the game are for them. What can we and what can't we do with them that not only dictates them having to avoid pain triggers and aggravators in day-to-day life, but also dictates which exercises or which tools that we can and can't use. Obviously, we can't give someone an exercise with the best intentions to fix the disc herniation when it gives them an extension intolerance instead. That doesn't make any sense. So again, we need to be careful. So we can't just shotgun random stuff at people. We have to see for each person whether that's going to work or it's not going to work, what the contraindications. So again, couch stretch looks pretty, innocent and harmless. But again, if you've got extension problems, significant loss of disc height, or you've got some inflammation in your facet joints, for example, that's probably going to make you worse, not better. And again, even if you do it and you get a bit of benefit, you're not actually addressing the underlying issues as to why that tightness is there. So again, usually for a lot of people, it's a lack of lateral stability and glute control. If you fix those 2 problems, which isn't going to be an overnight, quick fix, but that's going to stop it long term, and keeping those things in check is going to give you, a lot less pain long term as well. So again, it comes down to understand the problem at hand, just do away with quick, simple fixes. They don't really exist, so not for long term solutions anyway.